First set everything up.
Good evening, and welcome back to YBC Revolt Talk. I am Tanya Dunbar, and we are excited to be back as we continue our health series tonight. So we invite you all, per usual, to please be sure to like, follow, and share all of our social media outlets on Facebook, Instagram, and Twitter, and subscribe to our YouTube channel at YBC Revolt. Also, make sure you have your notifications turned on so that you do not miss out on our Black Health Trivia throughout this series and the free prizes and an opportunity to win. And lastly, but not least, please be sure to go ahead and share this active live so more people can tune in as we continue our journey of getting smarter together and educating the community. Tonight, I have joining me YBC members Rachel Kaufman and Eunice Pierre-Lewis. Hey, ladies.
Hi.
How y'all doing?
We're great.
Good to be back.
Yeah, so they're trying to upstand me tonight, y'all. They got to be all together in the same location and, you know, all that stuff. But, you know, it's okay.
Florida anytime.
I still love them. Anyway, so we're going to jump in. But before we do jump into tonight's session, we want to get started with our Black Health Trivia. So y'all know me, I'm extra. So, you know, I gotta, find my little music because, you know, I obviously was prepared with my little Jeopardy song. So hold on. Eunice wasn't here last time, Rachel, for our Jeopardy theme song.
Oh, okay. No, I did see it. I did watch it.
You tuned in, Eunice, you saw
I
us?
sure did.
We were a little extra. But anyway, so for tonight, for our first trivia, in keeping with tonight's theme of women's health and an acknowledgement of Breast Cancer Month, the winner of this question, we're giving away a tumbler. Tonight's show is again sponsored by F10. So you get a steel tumbler, custom to your choice, with whatever design. And we'll talk about how you get that prize and receive it. But the question tonight is, when a woman has been diagnosed with breast cancer, there are two types of procedures that can be recommended for removal of the cancerous tumor. Name one of the two types of procedures. Let me get to my music.
I think that's an easy question.
Yeah.
Someone in our audience is
Anybody?
I think the women will get it over the women.
That's probably right. Yeah, I think you're right.
For women not to do that.
But
Yeah,
I
we might
think
have to circle back to it if nobody answers, but we'll see.
yeah. And we'll just bring it back at the end. But I think it's one of those questions that over the past few years with more awareness, people are familiar with some of these procedures that can happen.
It looks like we have one person. Oh, Mamie Price. We got it right. She said mastectomy. I'm assuming that's what you're just saying. So Mamie Price is the winner of our tumbler tonight. Yay.
Nice.
All right, so Mamie, we'll reach out to you on how you get your item. We got your name down on Facebook. Okay. So let's just jump right in. Tonight we are discussing Black Girls Rock, women's health matters, because after all, our health is our wealth, right? And it's such an important topic, which is why we have been dedicated to doing our season 2 around health matters in a health series, right? So to discuss such an important matter and provide us with the guidance we all need, we have invited to tonight's show a special guest, Dr. Deborah Davis, who is an OBGYN. Dr. Davis is a native of Irmo, South Carolina. She graduated from Winthrop College with 2 degrees in biology and mathematics. She continued her postgraduate studies at the Medical University of South Carolina, where she graduated with a Doctor of Medicine degree in 1982. Upon graduation, she was commissioned as a captain in the U.S. Army and was stationed at Fort Bliss, Texas, where she completed a residency in I always mess up this word, y'all. Obstetrics and gynecology at the William Beaumont Army Medical Center. Dr. Davis served her country at Fort Bragg, North Carolina, and then later at Fort Jackson, South Carolina. She served with distinction and honor, obtaining the rank of major in the U.S. Army, and earned many awards, including the Army Archon for leadership and service. During this time, she was inducted into the Distinguished American Academy of Obstetrics. I can't say it.
Obstetricians. I got your back.
Thank you. And it's not nutritious, it's the obstetric. She'll say it for us. Gynecology is a fellow, because I can't get it together today. My words can't come together. Dr. Davis entered private practice in Columbia, South Carolina as an obstetrician and gynecologist. I can say that one. I just can't say the other one. I don't know. And has dedicated her professional life to the cause of women's health. She's delivered thousands of babies and counsels families on health and wellness issues. Her mission is to assist in improving the health of citizens and decreasing the barriers to care in South Carolina. She serves as the division leader of women's health at the Waverly Health Centers, a division of the Cooperative Health, leading a team of 6 obstetricians and nurse practitioners at 4 clinics in underserved areas around the Midlands. Dr. Davis is also a dedicated member of Pine Grove AME Church, my home church that I grew up in, the Columbia, South Carolina chapter of Links Incorporated, Zeta Phi Beta sorority. We won't hold that against her. I love them all, though. The Riley Institute for Diversity and Leadership, a board member of the MUSC Foundation, and also alumni board member of MUSC of Medicine. She serves as a mentor and advisor to medical students and medical residents in South Carolina. Dr. Davis is married to Dr. Isaiah Davis and the proud mother of 2 children, Dr. Melissa Davis and Dr. Isaiah Davis Jr., as well as the proud grandmother of little Isaac Davis III. So please join me in welcoming my almost lifetime friend and Dr. Deborah Davis.
Welcome.
Thank you. Welcome.
Thank you, Dr. Davis. We are so glad to have you join us tonight. Y'all didn't want to tell me that I still had the question going across the screen. Okay. It's all right. We're just gonna jump in. So Dr.
I just want to say thank you for inviting me in. I think this is a wonderful group, and I feel very honored to be here tonight and happy to answer any questions and share any information that I can with you to help women in the community to tear down barriers for access to care, but also to just educate the community about the importance of just wellness. So thank you so much, ladies, for having me.
Oh no, thank you for being here, and it's our pleasure to have such a person who of distinguished honors and has highly educated, and I know personally has dedicated her life to the community from a standpoint of educating women about health. So I was so honored that you were able to join us tonight. So thank you. We're gonna jump in, and we're gonna obviously field questions from our viewers as we go along as necessary. But we have some questions that we want to talk about as it pertains to women's health and the importance of it, especially for Black women, right? So with that said, our first question is, Dr. Davis, what would you say is the most common thing that women neglect about their health?
I think women as a whole, we're so busy trying to be mothers, wives, business people, that we tend to just neglect our general health. We're less likely to go in for an annual examination, and therefore the ability to have gynecological and obstetrical screening is lacking. There are barriers to that. Um, Breast examinations, cervical screening, STD screening, well health screening for weight management, cholesterol checks. We tend to put ourselves on the back burner because we're so involved in trying to care for the family. And the family is actually very growing because it's not just our husbands and our children, but with the extended family as well. And so it is not unusual that women put their lives on the back burner so they can care for the family. So
No, yeah, it's so true, right? I think we in this day and age, and I can speak for myself, even Eunice and Rachel, they always pick it because I have a million different jobs, and we're all trying to achieve the status of at least being comfortable, of not having to just have a job, right? Just over broke, as they say, but to be comfortable in life and just have your own, right? Something you can call your own. And with that comes, it's a heavy lift. It's a heavy lift. It's a lot of moving parts and pieces, and I think sometimes we don't realize all this, I think, undue stress that we put on ourselves. And so, one of the key areas as it pertains to women's health is obviously, to your point, taking preventative measures, right? So, you talked about women not always getting the gynecological visits and the annual checkups and getting tested like we should and know. But what are some of the other things in terms of preventative testing, and what are the age ranges that women should consider in terms of those preventative testings? And I'm talking about, just to clarify, like breast exams, thyroid exams, colon exams, other exams that are parts of our body.
well, we have actually began to do age management or specific management for all care, whether it's children, women, or men. So just general health. For
Okay.
those young girls who I would say prepubertal, that's, from toddlers all the way up to they begin having their cycles, having their care done by their pediatricians is so important. And basically, just a general examination, listening, but more importantly in that age group is vaccinations, making sure that that age group is vaccinated against the important viruses and
Yeah.
infections that occur in childhood, because those are the big things. And with COVID, a lot of young people have not been able, or a lot of parents not been able to actually go to their pediatricians and get vaccinations. But once you enter your reproductive stage, pediatricians continue to care for patients usually until they're about the age of 18 when they start going to college. And then women depend wanting to have more of a gynecological examination. They're more in tune to their femaleness. So breast examinations, you don't need a mammogram, but just being aware of what your breasts are. A lot of girls are engaging or becoming interested in sexual activity. So, as sexually transmitted disease screening is important, breast exams. You don't need to start pap smear screening until the age of 21. A lot of girls between, let's say, 18 to about 30 are interested in just the STD screening, the general examination, heart, lungs, vaccinations. We continue to do that, but also just counseling patients about the importance of contraception and the types of different kinds of contraceptions that we have to offer these days. It used to be the only thing we could offer was the birth control pill, but now we have just many different types of birth control that is safe and available to young women who are not ready to start families. But of course, those who are ready to start families, I think having pre-pregnancy evaluation, looking at weight, looking at your family history, whether you come from a family of strong diabetes, you want to be screened for diabetes. If you have weight challenges or weight issues, we want to get you into the best health that you can. We're not necessarily trying to make you look like Twiggy, but we're just trying to get you into the best health that you can. I tell you, women of color, we're not going to be thin, thin. We come with a little weight. And I think that's important. I think that's a beauty of us. But it doesn't mean just because you carry a little weight that you have high blood pressure, high cholesterol. Sometimes that's just genetic. But even taking that weight and making it the best health that you can, exercising, eating properly, getting your best rest, thinking clearly is very important. So
Right.
between the ages of 21 and up until 35, women are more interested in what is my general health, what is my reproductive needs, whether I'm trying to avoid pregnancy. And then we talk about the the types of methods we have to avoid pregnancy, and also those women who are trying to attempt pregnancy. How do we get you pregnant in your best care so we have a good outcome for delivery? Also, your general health is important at that time, heart, lungs, and any cholesterol problems or family issues or genetic issues. Once you pass 35 and into your 40s and 50s, many women have completed their childbearing years, but not in this generation. Your generation is putting that off. I have a lot of patients who are in their 40s having their first and second babies, which is amazing to me.
Okay. That makes me feel
We have some
making
questions about that, Dr.
Yeah.
Davis.
so
We got
making
lots of
sure
questions about that.
so making sure women can tell you their good general health. You shouldn't be afraid to have a baby after the age of 35. I know at one time we're telling people, of course, at the age of 30, the risks do increase. Well, they do increase. They have not changed. But women should not still be afraid of having children. I saw so many young women like yourselves are putting childbearing years aside because you're trying to attain your careers, trying to get yourself settled. I think that's very important because you want to be the best for yourself, and therefore you'll be the best parent that you can. So that's not a problem. But once you have completed your childbearing years, then it's more of a functional of breast examinations. Also, cervical screening we start at 21. We actually don't do pap smears like we used to. We used to do pap smears annually. Now pap smears are done every 2 to 3 years, and after the age of 30, we actually do pap smears every 3 years if you are not a carrier for human papillomavirus. And in my practice, every woman greater than 30 will get a pap smear with inclusive screening for human papillomavirus because I actually go out looking for that virus. If you carry that virus, then we might be a little bit more aggressive about your pap smear screening and maybe colposcopic examination, but certainly that's not going to keep you from having a pregnancy. Once you've entered or completed your reproductive, you're no longer having cycles, you're more into what I call your menopausal life. That's not the end of being sexually excited. So you still need STD screening, you need your mammogram, you need cancer screening at that time, colonoscopies, bone density studies, continuing mammograms from the age of 40 on. So I think, and also continuing your vaccines. I think, guys, we're in the era of COVID. COVID has changed the way we do everything, and definitely the way I practice. So we still need to be aware of those type of preventive things, avoiding those things, getting vaccines and immunizing ourselves against those diseases that we can, and just keeping ourselves aware so that we are aware of what's happening around us. So,
No, very good.
And I think the takeaway just from having this conversation is people are knowing that they need to go to the doctor and ask the questions because you shared so much information for us. So us just thinking the doctor will address one or two issues. There's just a lot of other things that can be brought up that needs, concerns. Just as a woman and as, checking on your health, then I think that we can find more information on. So thank you for that. That's my takeaway just from hearing you talk. So much more that I could learn and have more of a dialogue with my doctor.
and
Yeah,
I
so
think you're absolutely right about that. I feel like a lot of women, especially women of color, when we go in to see our providers, and many a times they're providers who are male, they're usually white males. They don't always take the time to talk to you or answer the questions. And sometimes patients themselves are reluctant to ask the questions. Sometimes people are reluctant to even ask me questions about things that are happening to them reproductively, how they feel about it. But it's important for you to open up and share those things. But the only way you're going to do that is you yourself have to be comfortable with the provider you see. So if you're not comfortable talking about those sensitive issues with your provider, it might be time to see another provider. That's the way I see it.
Yeah.
No,
I
I
agree.
So we have a question from the audience. Mamie wants to know, what are the top causes of death among adult women? Is it breast cancer or is it still heart disease?
Heart disease is definitely number one. Okay.
Mhm.
Heart disease is the number one killer of all diseases for women. But when you start talking about the number one cancer causing disease, it certainly is breast cancer. Okay. Breast cancer affects probably 1 in 7 women. We probably treated last year over 250,000 women with newly diagnosed breast cancer.
Wow.
However, breast cancer is something that we have gotten a good handle on. We can treat it better, but the only way we can treat it better is offering screening tests. Women who are usually have poor access to care, and that's usually women, poor women, women of color, usually can't get to a doctor to actually get the screening. Many of them are not aware that there are programs out there that offer free screening. We have best chance programs. I have an open door policy in my office because I think every woman age 40 and over, or any woman with risk factors for breast cancer, needs to have that very, very important mammogram yearly that will help us to identify any abnormality of the breast. As soon as we can identify, we can do a diagnostic test. If it's not cancer, we continue to follow. But if it is cancer, we can aggressively treat patients. And therefore, with early diagnosis and early treatment, we can have a better outcome for all patients. So heart disease is still number one mainly out there. So we still need to get our hearts checked, just like everybody else. It is the disease, hypertension, cardiovascular disease, and diabetes is these chronic illnesses for the people of color, and especially African American people. But it's when you start looking at cancer, it's definitely breast cancer.
Yeah.
That's good information.
Yeah, that's good
Yeah.
to know. So, question for you. So, men and women. So, most women, and some men too, at one point or another in their life, they're going to come across the yeast infection. That's the secret. That's not so much a secret, right? So, can you
No.
share with the audience what is it? How can we prevent it? What can we do about it? And is there some sort of relief that we can get? And how do we have that conversation with our doctor about, a yeast infection?
So I think that it's not uncommon that every woman will probably experience at least one episode of a yeast infection during her lifetime, mostly during her reproductive lives. Once the estrogen, once you start menstruating, the environment inside the vagina certainly changes and puts everybody at risk. Those people who are at the greatest risk of having recurrent yeast infection, because everybody will experience one or two infections, but when you have recurrent yeast infections, that's the thing that bothers women. So when I have women that come in with recurrent yeast infections, there's several things I want to know. Number one, I want to know if you're diabetic. A lot of diabetics have an increased risk for vaginal infections, and yeast is a very prominent infection. I can tell you when my diabetic patients come in, our diabetic patients are referred to me for recurrent yeast infections, is usually because their blood sugar is poorly controlled. Once they get their blood sugars in control, the yeast infection tends to go away. But not everybody is a diabetic who has recurrent yeast infection. So please think. But that's something you need to rule out. We also need to look at the types of things, whether or not patients are using certain types of douches, certain types of hormones, because what you want to do is keep the vagina, the pH balance in the vagina stable and more a little basic. Because once you get very acidic in the vagina, that's when yeast, which naturally lives in the vagina, seems to overgrow and becomes a problem. So looking at your diet, looking at your hygiene, also trying to other certain chronic illnesses like other than diabetes like hypertension, overweight, always put people at an increased risk for having yeast infections. Now, pregnancy is one of those things where you don't have to be diabetic, you don't have to be overweight, but it tends to change the flora in the vaginal wall and causes an increased risk of yeast. So yeast normally lives in the vagina. It's a normal inhabitant. You're in its room. It's just when you change the pH or the environment that it's allowed to overgrow and become a nuisance. But there's a lot of over-the-counter
Good
medications.
information. Yeah.
Yeah, a lot of over-the-counter medications that are really good. Sometimes I tell patients, Monistat is a great over-the-counter medication for yeast, but sometimes you have to use it a little bit more. I know they advertise it as this is a one-time use it one time and it should resolve. It might make some of your symptoms better, but sometimes you might need to use it for about 3 or 4 days to actually totally eradicate the infection. Now
So we have
remember, don't assume every infection in the vagina is a yeast infection. If you're using over-the-counter medications and your infection is not resolving, you really need to come in and see your doctor and let them screen you, because there are other inhabitants in the vagina that can overgrow and some inhabitants that might invade the vagina that's not expected, and you need to be screened and treated for those things.
So there's a question from the audience around that. Can certain antibiotics cause yeast infections?
Yes, they can. When you take an antibiotic, antibiotics tend to change the flora, the pH balance inside the vagina. So things like penicillin, many of the antibiotics, penicillin, zithromax, any antibiotic, and especially people who are put on high dose antibiotics and for a long period of time, like 10 days or 14 days, that seems to change the environment in the vagina. When I treat a patient with, long-term antibiotics, I usually supplement them with something for yeast. Many a times it's a vaginal product, but we also have some oral products that we can use, like diflucan, that you can take the tablet, maybe one tablet every 3 days, and that will reduce your chances of developing yeast. Because once you change the environment of the vagina, you increase the risk for certain things like yeast infections or other bacterial infections. So yeah, that's a great question. You're right. Thank
So
you.
I want to go back for a second, Dr. Davis, to the HPV. And there's a question around that. Do you recommend all young girls get the HPV vaccine? I know it's kind of there's been different talks about it in society, and
I like the advertising pushing for it in the current, I guess, generation or time right now.
Okay.
What are your
Thank
thoughts
you.
on
You're right. You're absolutely right. And thank you for that question. Well, first, let's talk about what HPV is. HPV stands for human papilloma virus. It is a sexually transmitted virus. So the only way you can get it is through intercourse. And there are over 100 strains of that virus. That virus can cause genital warts, that's we call condyloma. It can cause abnormalities of the cervix. And when we actually went back and looked at cervical cancer from a research standpoint, and pull old slides and old past specimens of women, even 50, 60 years ago with cervical cancer, HPV was there. So we know now that human papilloma virus is really the cause of cervical atypia and cervical abnormalities. So cervical cancer is not a cancer of genetics or a cancer of aging. It really is an infectious cancer. And the infection is human papilloma virus. And therefore, that is why we screen patients for human papillomavirus with their pap smears. Now, yes, I am an advocate of Gardasil. Gardasil is a simple injection, and given early enough, the HPV viruses, 16, 18, 35, 45, that are the usual characters that cause abnormal pap smears and therefore put a patient at risk of developing cervical cancer down the road, it would certainly prevent that. So actually giving Gardasil, and it's not just for women. I think we have this facade that it's just that we need to give it to girls. We need to give it to the guys too. So, and right now the insurance companies it is covered in the children's immunization package, so kids can start getting it at the age of 9 or 12. But you can also, young women who did not get Gardasil because the insurance didn't cover it, they're recommending now that you can give Gardasil way up until the age of 30. So even my age group of 21 to 26 that has fallen out of children's vaccines, I still offer them the vaccine if they want to have it. Now, human papilloma virus is a sexually transmitted virus. The more partner exposure you have, the more risk you have of actually developing human papillomavirus. So it's really important, guys, to get that word out that if you're not attempting pregnancy, you really need to use condoms. Despite the fact that women rely on birth control pills, injectable contraception, subcutaneous contraception, even IUDs, none of those things will prevent STDs. And human papillomavirus is one of the STDs. Once you catch it, it's not a drug out there that we can give you to eradicate the infection. So if you get chlamydia, gonorrhea, or even syphilis, we can give you an antibiotic and take away the infection. But things like herpes, human papillomavirus, and HIV, those things stay with you for a lifetime. And truly, the only thing we're doing is treating the symptoms of those infections and not necessarily killing the virus. So I am telling all my patients, if you're sexually active, you're not attempting pregnancy, please use a condom. Because condoms are the only things that will prevent sexually transmitted infections, the HPVs, the syphilis, the herpes, and of course the HIV.
Right. Thank you. I mean,
Yeah,
this
thank
is
you for that.
great information, especially for those people that are just, afraid to ask their doctors or don't have someone to reach out to. So if they
Yeah.
tune in, this is just excellent information.
Yeah, exactly.
So which leads me to my next question for you. In many communities, and in particular in the Black community, sex is a taboo subject. We're told, as a young Black woman at a young age, you're just told, don't bring home any babies. That's all you're told. But but the mechanics of it or anything else, there's no advice that's given. So I want to ask you, what advice would you give to a young lady who wants to start having sex, is already engaging sex? So what advice would you give her about not just about sex, but also safe sex? And then what are the health implications that should be considered?
Well, certainly we are living in a changing society. I mean, it is pretty much a sexual revolution. Okay. And because we have so many different mixtures of cultures, okay. Um, Teenage pregnancy is a very hard thing for young women to deal with. If you don't have good family support to help you with that, the pregnancy in itself, also the change in status that it brings about, and also the lack of understanding of how to care for, you're not even caring for yourself because someone else is caring for you, like a parent, and now you're asked to care for someone much younger than you. So there are a lot of emotional changes with it. The physical changes, of course, are, yes, for very young girls who are pregnant, the risk of the pregnancy, you have an increased risk of preterm labor, increased risk of ending up with some type of operative delivery, especially the very young girls. And I'm talking about the 12 and 14-year-olds who are carrying, their pelvises are just not ready to deliver vaginally. And
Yeah.
therefore, they end up with an operative delivery, like a C-section. And that's pretty traumatic sometimes. But I think that what we really need to do in our society is that we need to come together as women, and we need to stop feeling like talking about sex is a taboo thing. It's a very natural thing. And women and young boys all have that feeling. Once you start developing puberty, you start getting that feeling that of that relationship and that desire. And I think that we need to stop putting that in a closet. And we as parents, we have community leaders, we have health providers, we need to talk to the young generation about that. We need to talk to them about the risks of becoming sexually active, such as the STDs. More than likely, they're going to encounter an STD before they encounter a pregnancy. So, talking about the risk of chlamydia, gonorrhea, human papillomavirus is very important, and show them how that the more sexually active you are, the more different partners you have, the more risk you have of developing those things. Also, we need to not be afraid to talk about contraception. If I have a 14-year-old who's sexually active, my mother brings her in, I'm not afraid to talk to them about contraception. And that whole myth about where if you don't talk about birth control and you don't give them birth control, they won't be sexually active.
Lies.
We need to put that back in the closet someplace.
Right.
Because, because most young women and most youngsters in this country engage in sexual activity by the age of 12 or 14. So we need to start talking about contraception. And we have wonderful contraception options that will prevent pregnancy, not destroy fertility, that we can offer young people that, you don't have to worry about. And I can tell you, when I have a mother who brings her child into the office because the pediatrician is concerned that they're sexually active, and for the most part, young girls are not afraid to tell you, yeah, I've had an experience. Offering them some of the long-term contraceptions, like like the Nexplanon or the Skyla IUD, those things that last 3 to 5 years, they're reversible. A parent doesn't have to worry about whether or not, if they do something, whether or not they're going to be pregnant, because I'm going to tell you, that's the thing that most mothers and fathers worry about in the middle of the night when Johnny comes picking up your daughter. They're worrying about, she going to get pregnant tonight. So that takes all that stress off the table. So, yeah, I'm a big proponent of education about the methods of birth control methods, and taking down this whole veil, this myth about if you don't talk to boys, if you don't start birth control, you won't be sexually active, because that's truly not true.
Yeah. They're going to do what they're curious, right?
I think the
the
conversation
makeups.
just needs
But
to happen.
also,
And having a
but
doctor
also,
goes a long way. Mm-hmm.
but may I say something else? Because I'm a
Sure.
big proponent of this as well. For young girls who actually have unintentional pregnancies, because it happens to a lot of us sometimes, okay? We need to not turn our backs on those. Sometimes they're ostracized by their friends. Sometimes their friends' parents don't want them to come around because, oh, they have the pregnancy. And so if they're a bad girl, that means you might be a bad girl. We need to really embrace those people and keep them in our friendship chains. And we need to talk to them and encourage them. Because just because you have a baby and you haven't finished school doesn't mean that you don't finish school. Doesn't mean that you don't go to college. Doesn't mean that you can't go to graduate school and become a doctor or anything else. I think that we need to continue to embrace our young sisters, embrace our friends, and build them up and let them know that, you know what, this happens. This is life happening, but we don't turn our backs on them. And I think that is it's the shame status that I see in most of our young girls, because they're kicked out of their social group because they've done something that nobody else has done. So I wanted to say that as well. Thank you.
Thank you. Thank you. So what would you say, because I'm a part of the camp Start a Family. So that's where I am. I'm in the mode of nesting and trying to prepare myself for pregnancy and having a family. And you kind of talked about those of us that are in that range, really working with our doctors to make sure that our health is on point, our weights are where it should be, and things like that. But to kind of add another layer to it, I'm 30 plus a couple of numbers. So I'm past the age of 35.
Okay. Is that what we're calling it these days? All right.
Yes. So I'm in the camp of people that are 30s and we want to have a child. So are there additional things that I should be thinking of and others like me that maybe someone in their early 30s, late 20s don't necessarily need to consider when preparing for motherhood?
I think that I think a lot of women are postponing pregnancy because of careers, or they just haven't found the right person. Okay, and that's that's a real hardship. Trying to find your cellmate or your soulmate is not easy. Okay,
Yeah.
and believe me, I
Church.
tell people your soulmate and your cellmate are the same people. Okay,
Preach it.
and especially for women of color. So so yeah, you be, and you're not the only one postponing pregnancy or desire to be pregnant. But if you are going to be pregnant after the age of 35, we have to actually understand what is real. So after the age of 35, there's an increased risk of having a baby with a fetal anomaly. There's certain genetic abnormalities that increase with aging. It doesn't mean that you're going to have a baby that has a genetic problem. It just means the risk increases, okay? Just like the risk of aging increases cancer. Certain cancers increase with age. Doesn't mean you're going to get the cancer, but it means that you're in the age group for it, okay? So I would tell patients, I say, look, if you're exercising, maintaining your weight, eating a healthy diet, living a healthy lifestyle, you'll probably go through an uneventful pregnancy, just like a 25-year-old or a 30-year-old, okay? But there's certain tests that we might want to encourage early in pregnancy. We have a lot of great genetic testing that we can offer now. And we just don't offer it to the women 35 and older. I encourage those women strongly to get it, but I offer it to all of my patients because a 25-year-old can have a baby with Down syndrome just like a 35-year-old. The risk is just greater with a 35-year-old. So genetic testing is there offered. We can even offer genetic testing as early as 10 to 13 weeks. And so we can pretty much tell you not only the sex of the baby, but a lot of the genetics of the baby. With advancing age, of course, there's also the increased risk of developing diabetes as well as high blood pressure. So, when you say, is there a family history of high blood pressure or diabetes? It's usually true. Then it usually occurs if you actually go back and look at your family history. Your mother and father probably developed diabetes and high blood pressure as they got older. Stressed out of raising children, stressed out of sending everybody to college, and now working, trying to pay for all those bills, high blood pressure, diabetes, not eating well. So I usually screen all my patients for diabetes who are 35 years and older. That's a red flag for me. Let's just go ahead and screen you. I might screen you once, twice, or 3 times during the pregnancy. We monitor your blood pressure very closely. But to be honest with you, most of our patients, and we have a lot of patients 35 to 45 having babies, they tend to do very well. Especially if they don't come to us with pre-existing diseases. If they don't come to us with pre-existing diabetes, pre-existing hypertension, pre-existing chronic medical diseases, hyperthyroidism, hypothyroidism, obesity, and I'm talking morbid obesity. If they don't come with those pre-existing problems, the young, healthy woman tends to do quite well. So don't be afraid, you'll do fine. And we're happy to take care of you.
Girl, you covered. You work out so much. We know you got the obesity thing. Okay, you good.
You know what? That's exactly answer my next question, because speaking of working out, what about the snapbacks? So that's after you have the baby and you want to try to work as hard as you can, realistically, with just getting your body back to normal and back to your normal size. Is there anything that I might need to think of more so than someone that's younger after having a baby?
No. You don't need to do anything different. If you have a good exercise program and you work out and you eat healthy, you're gonna snap back, girl. You'll be all
Okay.
I gotta remember that term because nobody says it in our office. Snap back. I was like,
Leave it to Rachel.
Right. Only she don't come up with the terminology.
Gotta learn these new terms, I gotta learn them too. So you're teaching me too.
I mean, it is a lot of pressure. So that's just the way society is, and back to this over sexualized just world that we're living in now, where they just expect for you to have a child, and regardless of the age, for you to bounce back to the size you were before within weeks or months.
Yeah.
So
yeah, exactly.
Well, one thing you got to say, women of color are not looking like our white sisters. Okay, God didn't build us like that. God gave us hips. God gave us heavy bones. God made us beautiful. Okay, you're beautiful in your own right. When you look in the mirror and you say, to me, I tell my patients all the time, if you look in the mirror and you're 5'2" and you weigh 160 pounds or 180 pounds, but you can wear that dress, you can shape those hips, you're healthy, your cholesterol is good, and you're working out like crazy, but you can't seem to break it because it's all about the genes. There's nothing you can do about that. But you got to love yourself. You got to love yourself where you are. So when you look in the mirror and you see that image, that beautiful Black African princess queen, stretch yourself well. Put your chest out because we are built to bear children. And you will be fine. And any man who doesn't look at you that way is not looking for a real woman. He's just looking for glorification anyway.
Yes.
So,
we are thicker than a Snicker.
Don't worry about that. Always remember, the person that you got to make happy at the end of the day is you. And any man will see the beauty in you. It's not a skin thing. It's what's inside of you. And I can tell you got it. So what are you working on?
No podcast. See?
Yes. Right. So don't get beside yourself. Don't give her any extra boost with Dr. Davis. She is a mess. Well, we've been talking about pregnancy and young girls, but there's also the stage of menopause, right? So when we think about women and those women that are not yet menopausal, what are some things that they should be considering? Like, we've already had the babies and all of that stuff, but you're in that in-between stage. What are things you should be considering health-wise as they transition into that next phase?
Okay, so let's talk about what that next phase is, because there are a lot of stages in a woman's life. pre-reproductive stage is our reproductive stage. It's the dawning of our reproductive stage into a menopause stage, which I call perimenopause. Okay, so
Okay.
the term menopause means to me that you have ceased having periods for an entire year. So once you get
Oh,
to the point
wow.
in your life where you no longer have a period and you haven't had a period for an entire year, we call that you have entered menopause. Now, some people enter menopause not naturally. Some people enter menopause because we surgically take out your ovaries, and therefore you're no longer going to menstruate anymore or ovulate anymore. You have no more estrogen because we've taken it away from you, and we call that surgical menopause. Okay. So now the transition area between I finished having my children but I haven't stopped having periods. A lot of things happen during that time. Okay. Um, Menopause is not something that's an abrupt thing, it's a gradual thing. So as we gradually go towards 50 and 55, we might start seeing some changes in our periods. And some of those changes might be we might miss a couple of months here and there, especially as we get closer to the 50s and 55s. Our periods might be a little shorter. Sometimes your periods might even be a little longer. Okay. Sometimes you start experiencing things like hot flashes, night sweats. And hot flashes are just in the middle of the day. All of a sudden everybody else in the room is feeling cold and you're like, oh, cut the air conditioning on. You're sweating, things like that. Or at night, you're sweating at night, your husband's wrapped up in sheets and blankets, and you're like, stay at home. Those are temporary things. We're all going to go through them through our lives. But
Do they come at different times in your life, Dr. Davis?
no,
Because
no, menopause is genetic. I
okay,
can't tell you what your menopause day will be because it's a genetic code for you. But I can tell you that every cycle that you have, every menstrual cycle, the thing that makes you premenopausal is that you continue to ovulate, you continue to make estrogen, your ovaries are working, giving you that wonderful estrogen hormone that makes you feel like a woman, make you want to, the charisma that you have. As we age, that hormone decreases. And when that hormone is out of our system, that is when we are entering or have entered menopause. Okay. And that is why so many women try to replace that hormone in their life. And that's why we have hormone replacement, which really is estrogen replacement. So we're giving you back that estrogen that can cause, for women who have their uterus in, that can cause bleeding again. And so, that's not really what women want. When you go through menopause or you're perimenopause and you stop having periods and you're not buying tampons anymore, you're not looking for a drug that's going to make you have periods again. So,
no,
so
definitely
that
not.
that is
That
something that
is, you're absolutely right.
but there are some other alternative drugs out there. But some people, now hormone replacement is a whole different discussion because some patients are great candidates for hormone replacements, and sometimes hormone replacement increases the risk of breast changes, breast cancer, colon, blood clots, increase your blood pressure. So some of the things is basically if you're already at risk for something, you may not want that hormone replacement because you don't want to take those added risks. And therefore we don't really order as much hormone replacement. Years ago when I was in my training, that was you hit 50 and we were giving you Prempro and Premarin and everything. We no longer do that. Rarely are women on any type of estrogen replacement for the fear of breast cancer, heart disease, blood clots, colon cancer. All the things that we thought the hormone would replace and benefit, we found out that patients are more at risk. So I'm very, very cautious about putting patients on hormone replacement to, to offset some of the menopausal type of symptoms.
Okay. Well, so as we're wrapping up and getting to our wrap up, we do have one last question for you, Dr. Davis.
Sure.
And we talked about, the men and, the woman trying to be everything for everybody. But what are the impacts of menopause and or post delivery on a woman's sex drive? And what do they do about those impacts?
But I think that one of the things that we worry very much as we go through any type of change of life, guys, and it's not just having a baby. It could be loss of a significant other. loss of a parent, menopause itself, it brings about some type of mental stress and mental changes. One of the things that we see in women who have um, certain deliveries or expectations of the deliveries, maybe I have planned this perfect pregnancy and this perfect delivery, and I end up with a C-section. Postpartum depression, very prominent, and in menopause itself, depression. We lost our ability to have children. I'm not as beautiful as I look. I've got the wrinkles. I'm a little depressed now. So postpartum depression and menopausal depression, two different animals, treated the same way though. So a lot of it is therapy. A lot of it is sometimes if therapy doesn't work, we have to actually add in some medication. I think that for as far as postpartum depression, which is very scary because women tend to try to sometimes hurt themselves, sometimes hurt the baby. It's good that if you have a good family support system around you. I think some people have some baseline depression even before they get pregnant. And I think you probably have friends who actually you kind of know that they're kind of always sad, always depressed. And so the pregnancy just modifies or intensifies some of that. And so those are the people that you really need to give good support, good emotional support. And when you see someone beginning to fall through the cracks, beginning to get, I don't care about myself, I'm not taking care of the baby like I used to, I'm not taking care of myself, then you probably want to bring that person in, let them talk to a health provider, let them talk to a counselor. And sometimes we just could go through talk therapy, but sometimes medication therapy does. Now, on the other side of menopause, menopause is a lifestyle change, but people have to, I try to tell my patients, look, you should feel good about going into menopause. Look, you can have sex all day long. You don't have to worry about getting pregnant. You can be beautiful. I mean, what I tell people all the time, I'm so happy that we as African American women can do whatever we want with our hair. We are not having this, natural hair, add-on hair.
Absolutely.
We can
Yeah,
do
that's true.
whatever we want to do. And because we're not afraid to use, do skincare. I mean, we are really in about taking care of ourselves. So I think that, entering, my menopausal patients, they're on top of everything. They're doing what they want to do. They're exercising, they're living life. They've gotten their kids out of the house. They're loving their grandkids because we can pack them up and send them home with the parents at the end of the day. I mean, it's a whole different lifestyle. It's the happiness. So I'm about encouraging people for the wellness of it, and not so. But if you're struggling with it, and most of the time you're struggling with it because in your menopause, that's when life events happen. That's when you might develop a cancer, or significant other develops cancer, or you begin to lose your friends, or you begin to lose your significant other, and you have to go through. But those are the things that happen at the end of our lives. Okay, so those kinds of things are more likely to happen in your menopausal life than it happen than before your premenopausal. But that is why you have to have good friends, a good social circle to help move you on. So yeah. So
Well,
I
and a good
actually
church
have
family
one
is
more question.
always great. A good church family.
you got
I
one more
just have
question,
one more
Eunice?
question, yeah,
Okay.
because we won't keep you that much longer. So for the couple that has waited, they're now married, um, and now they are having sex, but they're unable
Okay.
to get pregnant. So at what point should they start thinking about there's a possibility of infertility
Okay.
and
So
and probably engage you as a doctor into that conversation?
right. That's a good question because couples are delaying pregnancy. So I tell my patients, depending on their age. I mean, if you're between 35 and 40, you know, you just trying to understand the relationship first and then have the child. If you've been really sexually active without any type of contraception for 6 months to a year and you have not conceived, you need to come in and let's have that conversation, okay? And definitely, I tell my patients if they're 40, you're 40 years old, you're married for the first time, you finally found that right person, You don't need to wait for a year. You need to come on in 6 months. In 6 months, you've been sexually active, not using contraception. Come on in and let's try to figure out what's going on. Now, guys, it's not always the woman.
Right.
Sometimes,
Right.
That part.
so we gotta evaluate the couple and not the individual person. I fed, I eat. This is not that.
Well, you have a house full of doctors. Her house is full of doctors.
You know, everybody's got an opinion, Dr. Davis.
Okay, Tanya, that's my son Ike in the background.
Yeah.
He was flying with a lot of people. I'm in a conference. No, I'm not.
That is funny to me.
Well, I think well, look, it's not always the girl. Sometimes it's the
Right.
guy. I think the couple needs to be evaluated, and so yeah. I think that one of the things that we talk about, because I do some relationship counseling, and so I think what happens is we have different types of relationships now, and sometimes relationships is hard. It's hard to be in a relationship. It's a work every day, and it's both people being honest in the relationship. And as we get older, and as we women of color get older, more than likely when you do meet that person that you call the person, it's probably going to be a person who might bring some other, I call it, people into the relationships. And sometimes it's a child, you know, and if you've never had a child and you're dating someone who has a child, that could bring on some challenges, because what you have to understand is that person has an obligation and responsibility to another person. Okay. And even if you have a child and you're dating a man who's never had a child, or a man with children, those bring on some stress into the relationship. And you need to work those things out before you solidify the relationship. Before you sign the marriage papers, you got to work those things out. Because any person that you're with, they should care just as much for you and your child as you care for them and their child. Because you're going to be a blended families. And blended families do work. And sometimes they're an advantage to the child because the child has more parents, more help, more people to go to ask advice and ask questions. And you might be the person who makes a big difference in your stepchild's lives, So you have to actually look at that. And of course, as you guys get older, if you're not in relationships now, you're going to meet people who come with us, and you're going to meet people who don't. And some of you are actually going to meet older people who are already finished with their families and not ready to do it again. You know what I mean? Not ready to start a new family. And so those are the kinds of honest, understanding, honest questions you have to get through at the beginning of the relationship and not at the end, because you never want your heart hurt. You know what I mean?
Yeah, so good. Such good advice, Dr. Davis. We thank you so much for being a part of our show and joining us tonight. Before we wrap up, we are going to do one more Black Health Trivia. So we've got one more question for everyone, and we're going to see. So our question is, what? You got to get them straight, Dr. Davis. You got to get them straight. Okay, the last question, and this person not only gets to win a tumbler, but you're also going to win a matching hoodie. So with the winter season coming up, you get your nice tumbler, and you're going to get a matching hoodie. So the question is,
very nice.
What type of deficiency is more prevalent in women than men? The hint is the symptoms include dizziness, weakness, and tiredness. Let's play our little music.
We have to have soundtracks, right?
Absolutely. Don't, come on. Humor me.
Come over here.
If we make you a TV host. The answer is pretty obvious.
had Lacey said vitamin B. No, close.
That's a good
Yeah,
one.
that is-
That's a good answer though. That's a
Yeah.
good answer. Anybody else got any? There we have it. Mona hit it. Iron. That's the answer. Yay, Mona. Okay, so Mona, please send us an email. The email address is. Hold on, I'm gonna send it back to you in the comments, Mona. But the email address is
With the soundtrack.
Huh?
You're sending it in the comments with the soundtrack.
I know. Contract.
Soundtrack. The Jeopardy song.
I don't know what she's talking about, but okay. The email is info.thefactory10@gmail.com. So I just sent it back in the comments to you, Mona. Please just shoot us an email that you are the winner, and I will arrange with you to get your prize, your matching tumbler and hoodie.
All right. So thank you for joining us for another YBC session. I hope we shared enough information with you tonight that either help you or maybe information you can share with a loved one. Please tune in for our next show. Men, we did not forget about you. So our next session will be discussing men's health, your body, your health, your change. So that'll be Thursday, November 5th, 7 p.m. Till next time, this has been another YBC Talk.